Perfect. Hi, everyone. My name is Marquette Lowe. I'm from Austin, Texas. I've been an LVN for the last 11 years. I've been with the company for the past two. In my current role as disease management, I focus on supporting our patients through education, prevention, and helping them manage their chronic conditions. I'm passionate about improving patient outcomes and making every interaction meaningful. When I'm not working, I'm dedicating my time to my husband and my 3-year-old son who is autistic. Thank you all for joining, and we'll get started here soon. So I did hear we're being recorded, so if everyone's ready, we'll go ahead and get started. Understanding low back pain. I'm excited to spend a few minutes talking with you about something nearly all of us experience at some point, low back pain. The big thing I want you to know right from the start is most low back pain is not dangerous. It can feel scary or frustrating, but in most cases, it's very manageable and temporary. Today's session is meant to be practical, simple, and relevant no matter your role, whether you're sitting most of the day, standing, lifting, or balancing high stress. Objectives. By the end of the session, you will be able to understand what low back pain actually is, identify factors that contribute to it, apply prevention strategies in the workplace, apply and learn some quick self-management tools. The goal isn't to eliminate every ache forever. It is to help you move confidently, understand your body, and reduce how much pain actually disrupts your day. So, what is low back pain? When we say low back pain, we're talking about pain between the ribs and the gluteal folds. Sometimes it spreads into the legs, and that's still considered part of the picture. But here's a key point. Back pain is a symptom, it's not a disease. Pain is influenced by our biology, but also our thoughts, stress levels, sleep, and even our work environments. That's why two people can have the same physical findings, but completely different pain experiences. How common is it? Low back pain is extremely common. About 80% of people will experience it at some point. It's also one of the leading causes of disability, but good news is most cases improve on their own. It tends to come and go, so understanding how to manage it helps you stay ahead of future flare-ups. Types of low back pain. There are three main categories here. Specific pain, which is usually 1 to 2% of cases. Radicular pain, commonly known as sciatica. I know a lot of people have this, 5 out of 10%. And then non-specified low back pain, which is the vast majority, so about 90%. Most people fall into this category group, meaning nothing serious is actually wrong structurally. What influences pain? Pain does not equal damage. This is one of the most important messages today. Pain does not automatically mean damage. Many people without back pain have disc bulges or arthritis on imaging, and many people with severe pain have normal findings. Pain is your body's alarm system, but alarms can be overly sensitive, so stress, fear, and fatigue can all turn the volume up. Workplace risk factors. What influences pain? Pain is influenced by biological factors like muscle tension, psychological factors that like worry or fear, social factors such as workload, stress, or lack of control, and lifestyle things like sleep, exercise, and daily habits. This is called biopsychosocial model, and it helps explain why back pain isn't just a physical issue. In the workplace, certain patterns tend to contribute to flare-ups. Sitting for long periods, standing without breaks, repetitive bending or twisting, and high stress levels. Different roles have different challenges. So, teachers stand and walk a lot, janitorial staff bend and lift, office workers sit for long stretches, and administrative roles often deal with high stress. Desk worker strategy. For those who sit for most of the day, alternate between sitting and standing. Take micro breaks for about every 30 to 60 minutes. Keep your screen at eye level. When lifting items, bend at your knees and keep objects close. And remember, there is no such thing as perfect posture. The best posture is actually your next posture. Teachers and standing roles. If you're standing or walking much of the day, here are some helpful habits. Shift your weight often, rest one foot on a small stool, move around rather than staying rigid, wear supportive footwear, add short foot and ankle stretches. The goal is to let your body move instead of locking into one position. For janitorial and physical roles, for those that do physical work, keep your workload close to your body, avoid sudden twisting, warm up your muscles early in the shift, build strength gradually. Lifting is not harmful when done with good technique and progressive training. High stress roles for those that are mentally have jobs that are mentally demanding, like admin staff or judges, stress itself can raise pain sensitivity. Simply reset can help such as slow breathing, stretching between tasks, movement breaks, long periods of focus. Movement breaks between long periods of focus. Managing stress can help manage your pain. So, this is going to be our first movement break. Let's take a quick 60-second movement break if you're able to stand. We are going to stand and I don't know if you guys can still see my camera kind of shifted. Okay, we're going to roll your shoulders back a few times. I'm going to do 5 times myself. And then gently lean backwards with your hands on your hips. So, hands on our hips, and we're just going to stretch our back. And we'll come back up. And then I want you all to walk in place for 10 seconds. Alrighty, and just shake it all off, and I'll go ahead and have a seat. These little resets can go a long way during the day. So those 4 things that we just did, if you can incorporate them in your day to day, that will be awesome and can reduce your pain. Case scenario number 1. Here's a common situation. An office worker has had back pain for 2 weeks and is worried about disc damage. Because they're afraid they stop moving, what would you suggest to this person? So, the best advice here is actually reassurance. Keep moving, avoid long rest periods, and gradually return to normal activities. We don't want our body to stiffen up on us, so stay active. Acute lower back pain management. When back pain first shows up, stay active as much as possible. Avoid long periods of rest. Heat can help relax the tight muscles. Most people start improving within a few weeks. Persistent lower back pain management. When pain lasts longer, the focus shifts to regular exercise, cognitive approaches that reduce fear of movement, breaking pain habits through small lifestyle changes. It's about building your muscles rather than trying to chase a cure. Medication. Alrighty, so there's a little bit of caution here. Medication can help in some ways, in most cases, but the benefits and risks may vary. Many medications offer limited relief. Opioids are not recommended for routine back pain management. Non-pharmaceutical approaches like heat, exercise, and education are often more effective long term. Alrighty, guys, we're here again at a movement break number 2. So we are going to do 5 chair squats if you're able. So I'm going to stand up and chair squat. So that means your bottom will just hit your chair, and that'll kind of mean that you've done. That's a good link to be. So 1, 2, 3, 4, 5. All right. And then 5 gentle Back extension, so kind of the same thing. We're just gonna go back 5 times. One, two, three, four, and five. And lastly, 5 deep breaths. All right, that was 5 for myself. I'll give you guys a minute. So these movements can help calm the nervous system and reduce stiffness. So if you're ever feeling stressed, go ahead and do these. Stop what you're doing and do these, and it can definitely reduce the stiffness. Alrighty. So to keep your back strong over time, think about strength training. So you want to also make sure you're getting adequate sleep, 7 to 9 hours of sleep, managing stress in healthy ways. Back pain is about fixing the spine. Back pain is less about fixing the spine and more about supporting your whole body. When to seek medical care. Most back pain is manageable at home, but you should seek medical care if you experience severe or worsening weakness, loss of bowel or bladder control, or unexplained weight loss. These are uncommon, but some very serious red flags. The key takeaways to wrap up, most low back pain is not serious. Pain does not equal damage. Movement is one of the best treatments, and most self-management is powerful. So, small habits every day can make a huge difference. I'm also going to go over the questions now that were sent in. I know there was a few people who wrote us. Let me get to that. Alrighty, so the first question that was sent in was, how do I prevent lower back pain? Preventing lower back pain is all about building strength, staying mobile, and reducing strain during your daily activities. So you want to strengthen your core, stretch whatever gets tight, improve posture, use good lifting techniques, avoid sitting for too long. So even if you have a job that requires you to sit, taking those breaks that we mentioned, and maintaining a healthy weight, healthy diet, and exercise as you can. Even 10 to 15 minutes of walking in place daily makes a huge difference. Another question we got in was, can back problem be a kidney problem? So the short answer is yes. Sometimes back pain can be caused by a kidney problem, but most of the time that is not the case. Here's how you would tell the difference in a clear, simple way. Pain is higher than typical low back pain. Pain is deep and constant. And then often other symptoms where it could be kidney related would be you're having fever, chills, nausea, vomiting, blood in the urine, frequent or urgent urination, cloudy or foul smelling urination, pain that radiates to the groin or lower abdomen. If you start experiencing those things, then yes, it could potentially be related to kidney problems. And of course, you would want to follow up with your primary care provider. With herniated disc, can the back be restored to a healthy range? So, yes, most herniated discs improve significantly over time, and many even partially reabsorb. But the most important point is you can restore strength, mobility, and function even if the disc never goes back to perfect. So it doesn't have to, completely restore for you to get that strength and mobility back. The goal isn't to undo the herniation, it's to make the spine stable, strong, and pain-free again. Another person would wanted to know what is better, a chiropractor or a physical therapist? Well, it kind of depends. So you would want to choose PT if you want exercise-based rehab, long-term strengthening, and functional improvement. And then a chiropractor would be for short-term pain relief through like hands and adjustment. Often the best results come from exercise education and occasional hands-on treatment, which is generally led by physical therapy. Does spondylosis ever go away after adequate amount of core strengthening training? The actual vertebrae slip does not reverse once it has occurred. The alignment usually stays the same throughout life unless it progresses, which is uncommon in adults. And then lastly, we had how to help with lower back pain that may have been caused by tight hips. So you'd want to do some gentle hip stretches, strengthen the hip and core muscles. Heat therapy can also help, movement breaks, posture awareness. So a lot of what we talked about earlier. But you do want to seek medical attention when the pain lasts longer than about 2 weeks. You're starting to feel numbness, tightness, weakness. Or, of course, if it's like pain from an injury or a fall, and also if you're having trouble walking or reduced mobility. So, those are the questions that we got answered online. And I would like to thank you all for your time and attention. And then I would like to hear from you. So, what challenges exist in your role, and what strategy will you try tomorrow?
So if you want to answer those questions, you can do them through chat, or you can also take yourself off of mute. This is part of the interactive part that we talked about initially.
I'll give you guys a minute to see if there's anything that comes through the chat. And this is also time, you can also ask your own questions as well. What questions can I answer for you today? If you want to come off of mute, like Heather said, or write them in the chat.
I know me for one will take some time and make sure I'm stretching throughout the
Yes,
day.
yeah, definitely. With these desk jobs, we get in our mode and then you forget to, your body kind of locks up. So by the time you stand up, you're like, whoa. So yeah, it's good to definitely do some stretches
So
every hour.
somebody did post challenges, the excessive sitting. A strategy that they will implement is we'll try to take more micro breaks and
Oh, good.
stretch.
Okay, good. Yeah, definitely. I would even set like a little alarm. I know my Apple Watch tells me actually it's time to get up and move. It's a cool feature. And so I'm like, oh yeah, let me get my body going.
Yeah, mine started doing that too. I now have it. It says you're sitting too long.
Yes, yes.
Somebody else said stretch.
Good.
And one of the things that I do is I have weights at my desk. So when my thing starts telling me that I've sat too long, I
Hmm.
I actually will pull my weights out and I will do some weights as well. Somebody said do hamstrings.
Oh, good. Yeah, definitely.
Do hamstrings play? Oh, this is a question. Do hamstrings play a
Oh,
role in low back pain?
yes, hamstrings can definitely play a role in low back pain. So, like if they are torn or sore, they can definitely cause your back to hurt. And so, you want to do those stretches. The biggest key with low back pain is making sure you're staying active and moving and doing stretches. Most of the time, if you can incorporate a good stretching method and even some exercise, you'll see a lot of the lower back pain reduce.
You talked a little bit early in the beginning about sciatica.
Hmm.
Um, what can be done to help with that?
So with sciatica, you can do again the same the exercising, but then also massaging too helps, and then the heat. So if you have like a heating pad, applying it there, um, but really just staying active and staying moving. My mother actually had really bad sciatica and she ended up having to get a major back procedure, but also she was sitting at her desk a lot and she was not doing any of the stretches. And if you're having that pain too, elevating helps as well. And just like the deep massaging of the tissue. Alrighty, guys. And what other questions do you have for me?
Again, if you have any questions, you can post them in the chat or you can take yourself off of mute to ask. No, ma'am. It looks like we don't have any more questions.
Well, thank everyone for coming and being here today. We will continue to do this. We have another educational session next week. What is it over, Heather?
It is on understanding high cholesterol. Um,
And that'll be Wednesday.
e Thursday, I think it's the maybe, yeah, it's the 5th.
Okay, yes, Thursday. Well, I
No,
hope.
it's the 4th. I'm sorry. So it is Wednesday.
Okay, Wednesday. If you guys want to hop on that as well. Super informative, lots of information, and I hope to see you guys again.
All right. Thank you guys for joining us. We greatly appreciate it.
Thank you.
You're so welcome. You guys have a good rest of the week and have a good weekend.
Have a good weekend.